Hi everyone. This video is designed for anyone who has sciatica that's related to stenosis. And stenosis is the abnormal narrowing of the canals in the vertebrae of the spine, and that puts pressure onto the nerves. So you might get like a zapping sensation down the leg or tingling and numbness. So what we want to emphasize in this video is flexion of the spine that helps take off the pressure of the nerves. Extending the spine and the arching the back can actually create and aggravate and make that pain come on. So please be aware of that throughout this, that even if you have any symptoms, to back out of it, be gentle. But we will be doing a lot of that flexion and emphasizing that to hopefully alleviate your pain. So put on your favorite playlist, grab a chair. We might use that, you might as an option, a block maybe, and then the two balls, if you have these, are two tennis balls, work great. And if you don't, that block will come in handy. I'll give you something else to do. So we'll start on our backs to begin. We'll come into a pose I really like for the low back. It's really gentle and mellow, that the feet come out to the edges of the mat, the knees drop in. I call this constructive rest. Just take a couple deep breaths here, kind of get settled, laying on your back, especially if you're in or feeling some pain or in some pain. It's great to really tap into your breath, right, to help decrease the tension in the muscles. And let's take the balls here, and you'll do like a little mini bridge. Press the feet up into the mat and lift the hips up, and then the balls will just kind of nestle in right at the glute muscles, and just kind of sway your hips side to side, giving them a little bit of a massage. You might feel one spot that has a lot of tension. There's a bunch of muscles in here that externally rotate the hip. Sometimes in these, with the low back pain and stenosis, sciatica, this can be aggravated, especially the piriformis, those external rotators of the hip. They can be really clenched and actually can create some of those sciatic symptoms. So be really mellow here. When I've noticed sometimes with patients, if they're too aggressive with this, can actually create pain. So, be really mellow. Go back and forth. We don't want to do this like all day long. Just a couple minutes here, moving the balls around, just swaying the hips side to side. Maybe lingering in a spot where you do feel a lot of tension, but come back to your breath. Right? If you hold your breath, that'll be that will tell you to stop, right? If you're holding your breath. So listen to that. If you don't have the balls, you could always, the other option is to have a block underneath your pelvis and take a supported bridge here. Super mellow and just chill here, staying with your breath. And then lift the hips up. If you're on the block or using the balls, just slide them off to the side. And let's hug our knees to our chest. Also flexion of the spine, right? As we hug the knees in Apanasana, maybe a little sway side to side if that feels natural for you. A little massage along the low back, swaying back and forth. And then the next one is the figure four. We'll stretch out those muscles, the piriformis muscle and the hip external rotators. And this is where we might use a chair. So what you'll do is cross the right leg on top of the left. And this might even be just where you are going to be. If this is really tight in the hip, we're looking for a stretch in that right hip. Just having this leg across, you're over top of those malleolus bones, the ankle bones there. You might just hang out here, or if you can reach through the little triangle, the little hole made, and clasp the back of the thigh and hug the thigh in toward you. If that's too much, you could try this on a chair. And sometimes here, actually in this position, I'll have my foot up against a wall and help to pull in toward me, right? And really flex at that right ankle joint, that dorsiflexion. One in, right? Hold there. Or the other option is to be in the chair. You can switch sides. To the left side, and I'll show you the left side in the chair. So you cross over here on top of the right thigh, and then lean forward, keeping that dorsiflexion, and rounding the back, kind of flexing the spine. A little rocking chair action here. Lean into it. Probably want to use a stable chair, but this is kind of nice. I'm rocking into it as I'm getting a little deeper and more open in the hip. Kind of leaning into it's kind of nice. Good, and then come up out of that. Uncross the legs, the figure 4, and then we'll come into a child's pose. So we'll bring on our knees, and then I like to do child's pose with my arms outstretched, the hips toward the heels. And really flexing the spine here. Remember, that's our focus. Good. Take some smooth, deep breaths here. So you feel the low back muscles opening up and releasing. And even with your breath, you're breathing into that area, breathing into the back of the ribs, kind of opening up the ribs like they're gills, like bringing life there and movement. Your attention. Good, and then come on up to all fours. Tuck your toes under, and then that's coming into a standing forward fold. So you'll hang down here, and the feet pretty wide. Maybe even as wide as the mat if you want, or as wide as the hips, and fold into it and down. Remember, I'm super bendy, flexy, so you may not look like this, right? So that's totally cool. Come into your flexion. If this is too much, you can always have your hands on that chair in your flexion here, or reach onto 2 blocks. And slowly come up to standing with the knees bent, right? Power in your legs when you come up. That helps support your low back. And then we'll do one more stretch, the hamstrings. So bringing the foot up onto the back of a ledge somewhere. It could be the back of that chair again, or up on the windowsill, or somewhere where you can tip forward, have that flexion here, and find the stretch of the hamstring. Lean forward. Toes point up. It's really key here, the foot positioning. So if the foot is kind of rounded and curled and inverted, you really want to draw that pinky toe back toward you. Press through the big toe, right? And that dorsiflexion of the ankle joint. Switch sides. Lean into it. Check out your foot positioning again. It makes a world of difference. Just even, if you have somebody even come over and make that, when I'm with a patient, I'll take my hand and make them do that dorsiflexion. So then it's like, whoa, there it is. There's the hamstring stretch. And you could be holding on to something too here, by the way, if you need extra support. Good, and then come on up. Place the foot down. Whew. Thanks for joining me. Namaste.